this is our kit. So our implants come in 3 different lengths: the 10 millimeter length, 11.5 millimeter, and 13 millimeter lengths. And then we have 2 platforms currently. We're going to expand that in the future, but right now we have 2 that are available. The small platform here is the 6.5 by 8 millimeter, and then we have a larger platform that's 7.5 by 9 millimeters. The system comes with this healing cover. It's kind of a flat healing cover that can be placed if you so choose, if you're going to do a 2-stage procedure. And then that capture screw goes down through the healing cover and engages in the implant, holds it over the platform so bone won't grow over the top of it like we saw in our beta tests. We were just discussing this earlier. Our empiric belief is that if we have at least 1.5 millimeters of bone between natural structures, that it would be safe to place the platform. This is our surgical kit. The way it's designed is on this side we have all of our burrs and our drills that we would use, and our paralleling pins. So the way it's set up is you start up here, and you actually take one of these guides, and we'll have some pictures of this. It's a platform osteotomy guide that's here. These are the small ones, these are the large ones, but we take this first platform osteotomy guide, and you can see that it's got a hole in the center so it can be self-retained. So once it's placed on the alveolar ridge, we use this little drill that's our pilot drill, place a hole, and then we go up here, we pick out a screw, because we have a little retention screw, place the screw in it, and then we can actually use this burr to create the osteotomy around here. And then what we've also found after doing these a few times is that now you can take that screw out, you can flip it around, and then complete this side by using this as the guide. So what you're left with is just a little round island of bone where the screw was retaining it. Okay? We have this open box that we've provided in case people wanted to more freehand it and or use it after you've used this retain guide, just to make sure you have the proper size. This is our platform guides, so you're able to use this, and you'll see it in the subsequent slides, but it's the exact size of the platform, so you can try it in and make sure that your osteotomy is of proper size that will accept the platform you eventually place. Once you have it prepared the same size, you can see that it has a hole in the center, and then it just becomes a traditional implant prep. So our particular implant only requires 2 drills. Okay, so we would then move here. We have a short and a long shaft of our initial 2.0 millimeter drill that you would go to length on. Then you have a parallel pin here. You can try it in, make sure it's adequate, seems to be parallel. And then you can take our larger drill and just start it. Most of the time, all you need is just to start it through just a little bit, just so our implant will begin to capture that osteotomy, the edges. So you don't go to length with this larger drill. Just start it. Okay? We'll kind of go through some of this. This is the procedure. Full thickness flap, exposing that alveolar ridge. This is that guide we were talking about. We have this handle that attaches to the guide, holds it in place. This is where the screw goes to hold the guide in place. What we have found is it's pretty tight with just the screw alone, and you'll see in a video that we see the handle go away, but we're recommending that you keep the handle on so you can just use the handle to actually retract some of the tissue, because we recommend that the handle be on this side. This diagram is incorrect. It should be toward the buccal, so it helps to retract some of the cheek. then we use our burr that's like a router that fits along inside of this guide and takes away the bone. Then, like I said, you can actually turn that guide around. So this aspect would be over here, and then you can complete the osteotomy on that side, and we'll show you that in the hands-on. And we are redesigning this system so it'll be easier to use on both sides. Once you have that box made, you take away your guide. You can test it with the open box if you need to. Pretty much what we found is you can freehand it, and you can use our curettes to level it out. If any of you have a piezo machine, it works great for this. You can actually use the piezo to level and make sure that the box is cut properly. You can even use some of the round diamond piezos and the flat diamond piezos right with our system, and it works fantastic. One of the surgeons here used that, and it makes a perfect osteotomy. This is showing that guide that we were talking about. This is the exact size of the platform that will eventually be placed. You make sure that it's seated, and then you just do the conventional osteotomy. Our 2.0 drill to length, the 2.5 just to start it. You don't need to go to length with it.
It's also just a kind of a caution. The 1.3 millimeter pilot drill is not meant to go all the way down. We just noticing people, if you're in type 1 bone really hard, you will break that drill. So it's really just meant to just start. It's just to find the center. You know, don't try to use that as an osteotomy drill going all the way down.
Yeah,
it's
just
not, it's not the purpose.
Just through cortical bone, 3 millimeters with the guide, with the pilot drill. Okay. Then the platform is placed, and then our implant is placed through the platform in the osteotomy. We have some platform holders that actually can be used to pick the platform up to place it, and then you can actually put the implant through the platform holder into the platform itself. Now, when Duncan had alluded to this, when you place this, it's not like conventional implants that you have to, go to a certain torque. You don't need to do that. All you need to do is place the implant through. I use it at 50. When I set my implant torque to 50, place it through the hole.
Torque at 50 or RPMs?
My torque and RPMs are down too. The RPMs are low. But yeah, and so the Newton centimeters is 50. That's the max that I do to place it. Some of the surgeons here were even down to 30. They were placing it. But what we want to do is just make sure that the implant itself is placed so it is just below the level of that platform, and you'll be able to see it when we do the hands-on. It goes just level or just below, and we're able to get just below, and then we know that that Morris taper or that taper between the implant and the platform is sealed. Okay? Then we place the flat healing abutment. We close it for 3 months, let it heal in. Come back. We have our 2 healing tissue formers that you expose it, take off the flat one, put it on the tissue former, leave it for 2 weeks, and then it's ready to be restored. And we'll show you this all in sequence in the video.
Ready?
Go. Yeah. So here's that full thickness flap, just an envelope flap. You don't have to do releasing incisions if you don't want to. There's the screw going in to fixate that. Here's the burr that you would use to make the osteotomy. Now you could take that out and turn it around, and you see you could clean out the rest of the bone with the guide in place, except for that center island. There's a curette that we have other curettes back there for you to use. Here's our implant guide. And then this is just showing several drills through, but all you need is two. One to length, the other one to start. Platform is placed, implant goes through the platform. Tissue or flat healing cover placed. Tissue's closed over the top. Allowed 3 to 6 months to heal. Should be 3. We open it up. We take the flat healing cover off. Place our tissue former. Close the tissue around it. Let it heal for 2 weeks. When the tissue former is taken off, you have access to the platform itself. Abutments placed. You can do an impression, make the crown. There you have it. Jim kind of went through some of this before, but the things that we can offer and help to make this process a little bit easier is to provide virtual surgery by actually making some stereolithic models. You can actually make some osteotomy guides that are custom. You don't have to use the ones that we have. This is for more advanced cases, but that technology is available, and we work with some companies that can actually provide this to you. So if you have some really difficult cases that you would like to have some assistance with this, it is available where you could do a CT scan. It's actually just uploaded as a DICOM file, and then over the internet you can do this virtual surgery with these companies and figure out exactly where the placement should be, and then they can make these stereolithic models and actually an osteotomy guide that you could use with our system.